methods would you guys use to immobilize that helmeted shoulder padded patient on the board?
Tape it,
What the
2-inch
blocks
tape.
are on?
Just
tape
tape
them,
Yeah.
tape them,
And
tape them to the
pad
board.
'em up here.
Yeah.
Or you can use the blocks if they fit.
Blocks.
Yeah.
Okay.
Throw a towel, maybe a towel around to remind
Horse
them,
collar.
you know? Cause that's all the C color does is say, don't move your neck,
Right.
cause they can still do this.
Yeah.
Right, right.
Yeah, that's a great idea, yeah, it's horse collars, you know, there's gotta be a gap there, well, towel, throw it around and tape it up in the front.
Yeah.
It's just another stabilization.
By the way, that reminds me, does anybody use those cowboy collars or anything anymore on their shoulder pads?
I have some at Birchwood that do.
Nobody at Rice Lake does, I'm surprised.
My
A
son
lot
did
of other,
because
I've
it
seen
made
a lot
him
of other
look bigger,
schools.
but-
Yeah, seen a lot of other schools use them. Of course, the big schools like Hudson and North, a bunch of their kids wear them, but our guy, you know, our small school, Rice Lake,
Would it change anything about the
Somebody's
equipment
at the front door.
removal or stabilization?
they suggest cutting off the cowboy collar. Just because that adds, I mean, depending on how thick it is, that can add another ½ inch and kind of put you in some flexion.
Theory on that was supposed to limit hyperextension, but I don't think.
I don't, most of
I
that's
think it's
just
for looks.
neoprene and, it's just a neoprene.
Just a reminder.
Yeah.
Okay, we were talking earlier, we had a question for you guys. Normally, if there was a downed athlete who, certainly if he was having airway problems or unconscious, you're gonna try to stabilize him, roll him over safely, so you can assess him. But what about the prone athlete who's conscious, breathing, who's laying there all crumpled up and he's got neck pain? Should these guys try to roll him and move him before you get there? Or wait so you have the board and?
I think they
I
should
would
be in a
wait.
supine position, and they should be in a anatomical position. You're not doing them any favors keeping them facing the dirt.
So
Well, if they're breathing fine and everything's fine. and
They've
there's
got,
complaining
yeah,
of
they've got the
neck
helmet to
pain,
keep
I would
space
maintain
between their face.
stabilization if they get the board.
You know,
Yeah, that's a
I'm
case-
talking
That's-
training
Yeah.
members though that are trained to do this, not
I don't
mom
always
and
have
dad
enough
in the
people,
crowd.
though.
You know,
I
but
don't
you
always
can
have
direct
enough
them.
people, yeah.
You know, we don't always have enough people, but we
Yeah.
can tell them
So
what to do.
Monica's alone up at Berkshire.
Yeah.
And, you know, maybe the coaching staff doesn't have a lot of savvy on it, maybe they do. She's alone and this happens, and now, how long does it take to get the first responders to Birchwood? I don't know, I think.
They usually
Anybody
have
know?
My
What about
issue,
practice?
my issue is with it. What do we have in front of in the helmet that's not in the back of the helmet? A face mask. So what does that do? Pushes them back like this when they're laying on the ground.
Yeah, if they're prone, if they're kinda curled on their side, of course, and I guess the
But
question
that
is
will
just
have to eat it.
to think about, if it's 5 minutes till you're there, should they keep them in the same position as long as they're alert and breathing fine, or should they try to manipulate them and move them around?
That's almost a case by case scenario.
I think the big thing is alert and breathing and.
If they can maintain their own airway, I'd say leave them right there and just, you know, hold C-spine at that point, because that's just one less move that we have to make later.
Yeah.
Yeah, 'cause then when
One
we-
move you can get them.
What we do then is just roll them
them
right onto the board from that position.
As long as, and that's barring, and like I said, each situation is gonna be different.
Yeah.
But you're confident that you have an airway.
Yeah, it's an optimal, I guess you
breathing,
could say
circulation,
optimal
all- yeah.
situation.